Khanna, California 17. Will is just a real treasure in his ability to work closely with members of the single payer movement, including Mark Dutzig, as well as myself with one pair states, and Ken Fursoff and David Loud have also been instrumental. So I'm not going to cut into any more of your time here, Will. If you can just help the group to understand where we are with the state-based universal health care bill, the rollout, and what it is that we can do to elevate the discussion, get co-sponsors on with the bill, and then even some thoughts maybe around educating on the bill, talking points. That's a lot to chew on, but do the best you can, and then we'll take some questions on the back end. Will McKelvey, thanks so much.
Sure thing, and I appreciate you all having me here. It's been a pleasure working with you over the past few months, and we're really looking forward to eventually rolling out the 116th Congress version of the State-Based Universal Health Care Act. As background, I'm sure everyone knows how Mr. McDermott pioneered the bill, and then Representative Jayapal took it over last Congress, and now that her focus has turned to the National Medicare for All bill, Representative Khanna will be taking the lead on the State-Based Universal Health Care Act. And so right now, the process that we're working on is basically just going through the bill as it was introduced by Representative Jayapal and, seeing if there's any tweaks that need to be made. But overall, the plan for the bill is going to be very similar to what it has been, which is create a waiver within the federal government, within the ACA, that allows for a state who designs a universal health coverage plan, most likely a single-payer plan, to apply for this waiver, which would then take all of the federal money that they currently are receiving through disparate funding streams such as Medicare, Medicaid, the Children's Health Insurance Program, the Federal Employee Health Benefits Program, TRICARE for military families, and basically it would allow the state to say, we've developed this plan for our single-payer program or universal health care program in our state, and if the federal government approves that plan because it does cover 95% of people within 5 years and then 100% after that 5 years, then the state can get all of that federal money sort of channeled into one major pipeline to fund their single-payer program. And so my boss has been working hard on this, and it's something he's really excited about. Medicare for All is, of course, his first priority as far as ultimate goal, but he thinks that, this can be an opportunity to really take the lead and allow some of our more progressive states to, take action where the federal government might be moving a little slower. Great examples would be California, New York, Washington State's got good programs out there. I've talked to folks from New Mexico. I think there might be 24 states that have some level of a single-payer movement within their state. And so this bill is to sort of provide empowerment from the federal level for those states to continue their push.
Terrific, Will. Yeah. So that's the description then of the bill itself, and then we are looking forward to the rollout. And what is it that you would advise folks to be alert to, looking to, and engaging in?
Well, I would say as of now, since we're still working through the finalization processes of the details of the bill, I'd say we definitely know we're not ready for any action yet, and we want to sort of keep this as under wraps as possible for now, just because, we want to make sure that when we do announce it, that it gets, the full excitement and buzz and really the energy behind it to really sustain the movement that you all are pushing for at the grassroots level. And so as of right now, we're working through the bill text, and then once that's completed, we're going to target a day, which is, to be determined. We'll figure out a day, and we'll coordinate a whole announcement with press and with working with all the groups and folks on the activist ground level to, like I said, generate the maximum buzz. Because what a bill like this is, it serves as a signal to every single state and every single state legislator who's considering these single-payer programs at the ground level that, there is support at the federal government. And so we want to make sure that, when we roll it out, that it has lots of co-sponsorship from the members across the board in the House. And so that's where you all will be really important as we finalize the text. I'll be working with one-payer states and other groups to give you guys all the information on the bill, so you can reach out to your own representatives in Congress to encourage them to share the information on the bill and encourage them to sign on as original co-sponsors. One thing I've learned working on the Hill is that, I can, from a staff level, I can talk to someone in another office and recommend a bill, but what they'll listen to the most is if they hear from a constituent. So if you're from somewhere in Washington State and you know who your congressperson is and you send them a letter, an email, or if you get a meeting with them in their office out in their district, that does so much to get their eyes on something that they might not have even been aware of. It could be even something as simple as they're supportive of the bill, but there are 7,000 plus bills introduced every Congress, and so being able to have the grassroots support to put this in front of the people who need to see it really goes a long way towards generating the levels of congressional support that help it get buzzed. And so as the bill gets finalized, that's when I'll be coordinating again with David and Chuck and Ken and One Pair States generally and all the other activists to get you all the information so that we can make a coordinated effort to generate as much excitement and interest in the bill as possible.
Perfect. Will, thank you so much. That really, really helps to round out the understanding as to where we are right now. Why don't we open it up for a couple, 3 questions, see where how far we can get?
I'd like to ask a question, Chuck. I've lost my
Who's
video.
this?
It's Bill Bronston calling.
Oh, Bill, okay, hang on. Don't ask it yet. So you're number 1?
I don't have
Anybody
my video
else?
for some reason.
Yes.
Mike Huntington.
Mike Huntington, okay.
And Marcia Stedman.
And Marcia, okay. We're going to have to stop there just for time constraint. If we get through it that quickly, we'll go further. But Bill Bronston, fire away.
Well, this is a rather complicated question. It's been eating at me for some time. Are there any qualitative or program design guidelines that are basic to the permission of states to establish their program? For example, the question of democratic governance does not seem to appear in any bill that I've seen. That is, there's always a definition of a program that has a governance apparatus at the state level, but it doesn't go down lower into a more community-based control or influence over resources. So, for example, there is no county or city or neighborhood kind of requirement, which is one side of the question. The other side of the question is there any kind of guidance to promote neighborhood comprehensivity? Because what we have now, as a result of the way in which money is concentrated, these gigantic institutions that essentially are like basilicas, in various program areas, but people that don't have services have to travel significant distances at significant cost to get to these large hospital complexes.
Okay, Bill, thank you so much. Will?
I'd say so. So the bill gives a decent amount of leeway to individual states to coordinate the plans. And actually one feature of the bill that I'm really excited about, that was included in the last version, but I still think is very important to highlight, is that it also allows regions to band together. So, let's say California, Oregon, and Washington State wanted to work together to create a regional collaborative single-payer program. It would allow that. But basically, I make that point because the bill does give some leeway to states in terms of how they can craft their plans. And I think that's really where, so we will work in tandem with the folks at the ground level, at the state level. So, Bill, that's a great point you make. And I think that's where, when you're working with your state level legislative officials, you can emphasize that would be a necessary component of wherever your state's plan that they're eventually looking at designing and eventually implementing. But as far as individual requirements, we don't really want to dictate specifically how a state does it. I know, the needs of New York are very different than the needs of California. For instance, New York has commuters from at least 3 different states. California doesn't deal with that as much. And so because of that, it's less prescriptive on the details at that granular level, but that doesn't mean that they're not important. And so I think that's where the role is, the state level activists, you work hand in hand with your state legislators in implementing your plan. And so you can talk about something like neighborhood oversight and neighborhood comprehensiveness. But so what the bill requires what plans will have to have is benefits that are as good or better than the benefits already being provided by the programs that they're diverting the funding from. Like I said, universality after 5 years. So those are things that are really important. And then as far as more details, that's where, the states can come in and sort of make their decisions, and that's where you all can come in helping the states make those decisions.
Terrific. Mike, thanks so much. Will, I think helpful answer, definitely. Mike Huntington?
Yes, Will, how shall we best talk with our current representatives? We have 3 that signed on to the 6097 last year. Should we just say, be alert, there's going to be a reintroduction of this, or what wordage is best?
I would say hold off on talking about it at all for now. I mean, like I said, 7,000 bills get introduced every year, and so for the staff of the members, it's a lot to sort of take in at one time. So I think you'll have the most effective interactions once the bill is introduced or once it's very close to being introduced. And so then the other big thing is that last year the bill number was 6097, but those bill numbers are just assigned by the order in which they're introduced. And so last year Congresswoman Jayapal introduced it, I think in September or October of the second year of the session. We won't be waiting that long, and so we'll probably have a lower number than that. So I would definitely identify the bill by its name, the State-Based Universal Health Care Act, rather than the bill number, especially prior to introduction.
Okay,
so
Mike?
6097 will not be the bill number this year. Yep.
Thank you.
Okay, that's very helpful. Thanks so much. Marcia Stedman, Washington State.
Yes, thank you. Can you hear me?
I hear you just fine, Marcia.
Okay, great. So the activists in Washington State are chomping at the bit to get something done on the HR 6097. So we're wondering, how is your office working with other congresspeople to get co-sponsors in advance of the final bill being released? You mentioned that you were doing that. Are you really doing that, and how are you doing that, and what is your procedure for that, and what can we do to help at all from here? I know you said we can't really do much right now, but still asking a question. Thank you.
Yeah, it's a great question, and it helps. I think it's important to see the internal window of sort of how the sausage is made and how it works from the within congressional level. I mean, because a lot of times, like I said, it's very much an inside-outside, which means from the inside, I will be, once the bill is finalized, because again, the bill isn't finalized yet, but once the bill is finalized and we're getting ready to introduce, I'll be working from the inside, reaching out to my colleagues and friends in other congressional offices, especially from members who I think will be supportive of the bill, and I'll be sharing the text with them and, giving them kind of the spiel on it about like why it's necessary and what it does and yada, yada, yada. And so then the outside part of that is when you all come in. And so I will be reaching out to my staff level colleagues, but then at the same time, they'll also be getting emails or letters or meetings. If you can meet with your member in the district or in DC, if that's possible, that's when that sort of reinforces what I've already shared with them. So basically, I'll reach out first, give them all the information, and so then they're aware of it, and then sort of the shove they need comes from their constituents, which would be you all. Based on wherever you live.
Great, thank you.
All right,
problem.
terrific.
When do you think
Fantastic, Will.
we'll be able to see
excellent.
the text?
That's to
Will?
be determined. There's a lot of balls in the air, but as soon as it's finalized, one pair of states will be the first to know.
Yep. All right. Yeah, it's just a question of timing and release and coordination.
I was checking out
so
more details on that, but
Yeah.
We'll see.
No, we absolutely appreciate you coming on, and I mean, as you can tell, that our members here are ready to roll when you're ready to release, and we've got the energy, we've got the firepower, and the growing organization, and we'll stay in touch. And I mean, it could be that we're going to, depending on where things are, we may ask you to come back next month just for a quick primer if there's new developments. And certainly this is our top legislative priority at One Pair State. So thanks ever so much for getting on the call. Again, we'll stay tethered. And to Mark Dudzig, if you're still with us, Mark, fantastic job. And folks who ask questions throughout, thank you so much. And we'll keep updating through email. Our next call is scheduled for Friday, September 20th, 12 noon Eastern Time, 9 Pacific. Again, Friday, September 20th, mark it in your calendar, and we'll look forward to catching up then. Everybody have a great weekend. Thank you so much.
You all.